Pressure injuries in the nursing world are essentially a crime and reflect negligence and abuse, even if unintentional. If we want to address this kind of crime in the nursing home setting, we must first identify the culprit. Pressure. Bed sores in the nursing home are known as pressure injuries, or PIs for short. Do you know any places in your body where a PI could develop? Head, shoulders, knees, and toes? No. Tailbone, hips, heels, and elbows? Yes. Poor mobility, sitting in feces and urine for too long, lack of sensation, poor nutrition and hydration, and conditions like diabetes and vascular disease all contribute to this. Staff shortages, poor communication, and gaps in nursing knowledge can complicate things even more. That's why older folks in the nursing home setting are the most prevalent of cases. Preventing pressure injuries in the long term care setting can be effectively managed through dancing in bed, playing detective when an underweight patient is not eating, and fostering clear communication regarding care needs between the caregiver and the one being cared for. Did you know that dancing in bed can prevent bed sores? If our body tissues are like cars, then our blood is a gas station on wheels. Our blood delivers glucose and oxygen throughout the body. This is our fuel supply. When we apply prolonged pressure to a certain area for too long, uh, we're cutting off that blood supply and the tissue begins to die. Eventually, it can die if there is prolonged pressure. This is why dancing in bed is important. According to an entry reviewed on October 28th, 2023, in the Medical Encyclopedia from the National Library of Medicine, changing a patient's position in bed every 2 hours helps keep blood flowing. If you didn't know what dancing in bed looked like before, it's essentially turning completely onto your side and holding that form for and to the rhythm of every 2 hours. This is basically a dance battle, and if you can dance in bed every 2 hours, the battle is half won. However, putting food in your belly, especially when you're not putting on enough weight, is just as important of an ally. When an underweight patient is not eating, you must play detective, figure out the problem, and provide a solution. Who is more at risk for getting a PI in the nursing home? Someone who is morbidly obese or someone who is underweight? According to a 2021 study by Lembley and Primiano published in the Clinical Nutrition textbook, overweight was associated with lower odds of pressure ulcers, while underweight was correlated with higher odds of pressure injuries. According to a German study titled Underweight in the Nursing Home, Differences Between Men and Women from Gerontology published in 2021, it was noted that the biggest difference between normal and underweight individuals was regarding loss of appetite, which affected 41.1% of the underweight group. Functional limitations of arms and hands occurred in 24.9% of the underweight residents, chewing problems in 18.1%, and swallowing problems in 16.2%. So what can we do when an underweight patient of old age is losing their appetite and we notice these problems above? We can review their dietary preferences, assist them with eating if they can't do it themselves, downgrade their textured diet to pureed foods if they can't chew, and offer oral supplements like health shakes if they're having trouble swallowing. Allowing our inner detective to find a perfect solution to these not so perfect problems regarding an underweight patient's appetite loss saves us from getting one more bed sore. But the key is communicating the solution. Communication regarding the patient's care assures that everyone is on the same page in the best interest of the patient. A lack of communication regarding an individual's care needs can put them at risk for PIs if those needs aren't met. According to a study published in October 19, 2019 from the International Journal of Nursing Studies, the issue of pain and or discomfort was a significant concern for individuals at risk of developing pressure ulcers, and it was also described that pressure relieving equipment was uncomfortable, and where this was the case, the equipment was less likely to be used. If the patient is in pain, they won't turn. If they are uncomfortable, they won't use the pressure relieving devices. If they aren't eating, their skin integrity becomes compromised. If they aren't educated properly, they won't know how they can actively contribute to PI prevention. Physical therapy and occupational therapy and dietary services also play a role in patient's care. The therapy team contributes to a patient regaining their physical strength so they are able to turn and reposition more effectively. The dietary team evaluates their nutritional needs to assure that they're receiving adequate calories and protein. The nursing team brings all these concerns together and creates an individualized plan to address all these needs. Pressure injury prevention is holistic, and no one individual or team is responsible for all of it. With the PI interventions we learned about in this speech, we can incorporate them immediately against Mr. Pressure so we can put him under pressure and behind bars for good. If you can remember that 1, dancing in bed to the rhythm of every 2 hours, 2, pulling out your magnifying glass and figuring out how to get an underweight patient to eat, and 3, communicating what the patient needs from you and what you need from the patient clearly, then you learned something today. Pressure injury prevention isn't exclusive to the nursing home setting. It can be utilized across all healthcare settings, even at home. That just goes to show that you don't need to be a medical professional to stop a PI crime from happening in your neighborhood. Thank you. Hmm?